Be sure to remove all soft tissue from the anterior cortex using a flat Hohmann retractor. Step 1. Place femoral cutting block on the distal femur by pushing the block into the trochlear groove and down on the distal condyles. Tip: the proximal part of the femoral block should rest on the anterior cortex to ensure that the block is not in flexion. Step 2. Allow the surgical assistant to firmly hold the block in place while the surgeon drills through the 2 distal holes using the 1/8 inch drill bit. Step 3. Insert long-headed pins into the distal holes that were drilled. Step 4. With the distal pins in place, pin the anterior face of the block using either speed pins or by drilling through the holes and using long bone spikes to secure the anterior face of the block. Note: the vertical etching represents the AP axis, which can be used with the perpendicular epicondylar axis to show rotational alignment. Step 5. Remove the distal pins and make the distal cut. Note: these pins match the standard MIS distal cutting block, so additional bone can be taken if necessary. Step 6. Proceed with the remaining femoral cuts by using the appropriately sized AP cutting block. Sublux the tibia. Remove the meniscus. Make sure all the proximal anterior loose soft tissue fibers have been removed. Step 1. Place the tibial block on the proximal tibia. The key contact points for the tibial block are the medial and lateral plateaus and the anterior medial tibial face. Note: the cutting block should be resting flush on all 3 surfaces. If the block is not resting flush, remove any osteophytes or soft tissues that are impinging the fit. Step 2. With the surgical assistant firmly holding the block in place, drill and pin the 2 proximal holes using long-headed pins. Tip: this is important to ensure that the tibia does not rotate or change varus valgus while pinning anteriorly. Step 3. With the proximal pins in place, pin the anterior face of the block using either speed pins or by drilling through the 2 holes and using long bone spikes to secure the anterior face of the block in place. The additional anterior hole above the slot can be used to further secure the block during resection. Note: the anterior etch marks the medial third of the tibia tubercle. Step 4. Remove the proximal pins and resect the tibia. Note: these pins match the standard MIS tibia cutting block, so additional bone can be taken if necessary. Also note: the pinholes from the patient match cutting block match the pinholes for the tibia trial and set alignment and rotation. Step 5. Proceed with trialing and implant placement using standard instrumentation. Note: Visionaire patient match cutting blocks are available for Journey BCS, Legion Primary, and Genesis II implant systems.